Welcome to Beyond the Needle, the Aesthetics Business Podcast. I'm your host, Emily Ruse. I'm a former clinic manager turned digital marketing freelancer, and I've had the privilege of helping dozens of aesthetic practitioners across the UK and beyond grow their business. So I know firsthand just how challenging it can be to build a successful aesthetics practice in today's competitive market. Each week, I'm here to share real, actionable strategies and bring on expert guests to help you level up, attract more patients, and build a standout brand. Let's turn your passion into a thriving business together. Welcome back to another episode of Beyond the Needle, and today I'm delighted to be joined by Dr Olivia McCabe-Robinson, a surgeon turned aesthetics doctor who has made waves in the aesthetics industry, not just for her skill as a clinician, but for her commitment to research, education and patient safety. After leaving her surgical career in the NHS, Olivia has fully dedicated herself to aesthetics, growing her practice at Dr Olivia Medispa and doing her bit to make aesthetics a safer place. She is the founder of the Northwest Aesthetics Research Group, a collaborative space where practitioners critique, challenge and push research forwards with the goal of setting higher standards and ensuring real-time clinical data is available across the UK. But Olivia's impact doesn't stop there. She is deeply passionate about patient safety. She has made the incredible decision to treat emergency aesthetic complications pro bono, ensuring that patients, regardless of where they were originally treated, receive the care that they need. This decision was solidified when, on Christmas Eve in 2023, she was presented with a patient suffering from a severe complication. After being refused treatment elsewhere, Olivia stepped in, highlighting the gaps in patient aftercare within the aesthetics industry. In this episode, we explore Olivia's transition from surgery to aesthetics, why she made the leap and how her surgical background shapes her approach, the importance of research in aesthetics and how the industry can improve evidence-based practice, her experience with training, speaking and mentorship and what needs to change in aesthetics education, why she treats emergency complications for free and what this says about the current state of patient aftercare, the rise of misinformation in aesthetics, how social media is impacting patient expectations and what we can do about it, her passion for educating young people, and her PhD future plans, where she sees aesthetics research heading and how practitioners can get involved. Olivia is someone who is challenging the status quo, pushing for higher standards and making real change in the industry. If you're a practitioner looking to elevate your practice, deepen your knowledge or simply be inspired by someone who truly cares about patient outcomes, this is an episode you won't want to miss. Hi Olivia, welcome to the podcast.
Thank you.
So Olivia, you originally trained as a surgeon and only recently left your NHS career back in 2023 to fully focus on growing your aesthetics practice. What was it that made you take that leap?
So for me, I think I'd had children. So they always say in medicine, there's no real good time to have children, especially in surgery, which is still very much a man's world. And I'd gone ahead and started a family with my husband. My husband was also a surgical trainee at the time. And we just thought, there's no good time. Let's just do what we want to do and we'll try and make the rest work. And then after I had children, I went from being extremely surgically focused. So I would be first in, last out, always doing extra, always teaching and training, trying to get extra requirements on like the CV, to just not caring that much. And I know that sounds really blunt. I cared so much about my patients, but I just didn't really care about the struggle of being a surgeon anymore. And it took about 18 months to make a decision to finally leave. But what basically happened is I just became more and more unhappy over time with the fact that I couldn't spend the time that I needed to with my children. I grew up and my parents were both in the police, so I knew what it was like to have, I don't want to say absent parents, but children being brought up by someone that's not necessarily a family member. We'd taken on a nanny and I just sat there one day and thought, I just don't want to do this. This isn't the life that I wanted. I grew up having this side of life and I didn't really want that for my kids. And no matter how much I love my job and I love the people that I treat, it's not worth it to sacrifice my children and their happiness, basically, or my own.
Yeah. I mean, that's completely understandable. And how has the shift into aesthetics changed your kind of family dynamic now? Do you feel like you're a lot more present or as present as you want to be?
Yeah, so actually I do the school run every day, except on Wednesday where Paul's off work. So I do school run every day, and then I do my clinics around school. So I do a clinic 9 till 3 most days. And then I do pick the kids up from school, do tea time, bath time. And then as they're going to bed, I come back out and do an evening clinic 3 days a week. So on a Tuesday, Wednesday, Thursday, I do a 7:30 till 11 p.m. clinic, which people think is ridiculous. I cannot explain how busy those clinics are, because most of the people I treat are in exactly the same boat as I am and have young children at home that they need to get to bed, that feel guilty if they have to leave them during like one of those important times of their day when they've already been at school. So actually it works really well. It was a bit of an adjustment to begin with, like anything is. I thought, my brain's going to fall out because I'm not going to be entertaining myself enough. So I started a PhD mainly for that concern. But actually, in reality, I'd have probably been fine without a PhD. I do lots, and it's very busy. But I also enjoy the PhD because it gives me a different kind of brain space and head space that I get to enjoy a couple of days a week as well.
Yeah, and you can continue kind of growing your knowledge and
Yeah.
How did your experience in surgical training shape the way that you approach aesthetics?
So for me, surgical training is a bit of a dog eat dog world. It's very hardcore. It's very intense. You don't want to be the one that doesn't know everything, because it's quite embarrassing when you're in that field and you know that there's a very few number of jobs and positions and everybody's expected to be excellent all the time. In terms of how I've used that to craft a career in aesthetics, I'd say I try and be ruthless at the times that I need to be. So when it comes to business planning, strategy, taking time away from the children, then I have to be very ruthless in terms of, if it's not worth my time, then I don't do it anymore. In terms of the other bits, I actually don't think there's a huge amount that surgical training is necessarily offered to a career in aesthetics. I don't think you need to be a surgeon to be really good at aesthetics. I think there's, loads of medical fields where people have different sets of skills and are all fantastic at the job. I think one thing that we do a lot of in surgery is we do a lot of evidence-based research, reading literature, practicing based on literature, a lot of clinical studies. So I sit very happily in that world. And I feel like that's maybe influenced me a little bit more, being very evidence-based in aesthetics. So I'd say that's probably the biggest thing. But again, there are other specialties that are very similar. So I wouldn't just say that's isolated to just a surgical career.
Yeah. But it influences the way you look at products, I'm guessing, or treatments that you're going to offer and bring into clinic.
Yeah, absolutely. I feel I need to understand everything about the product, everything about the treatment, everything about, the potential complications before I'm willing to even try that product myself, never mind bring it into clinic and expose my patients to it.
Yeah.
So yeah, it just adds like another safety net layer, I guess, for the patients.
Absolutely. And you've spoken before about the NHS not being quite 21st century when it comes to working mothers. Obviously, you've mentioned challenges around the time that you were able to, or the lack of time that you had to spend with your children. What other challenges did you face, and how is it different now running your own aesthetics business? What would you say is the biggest kind of difference between the two fields?
I say the companies that I work for in aesthetics are extremely open to flexibility. They're extremely open to the fact that you've got children, you can't always commit everything all the time. They are very about empowering females. They are very about trying to push females. And I'm talking specifically here probably about Dermafocus as a company, because they're the ones I probably have the most kind of contact with in terms of an external company. And they are very keen to push females forward. Like when I started working with them, I really was genuinely a nobody in the business. I had a tiny business. I hadn't even left the NHS. And they took a chance on me, even knowing that I couldn't commit loads and loads of time to them, because they felt that I added value to them. Whereas what I was getting on the flip side in the NHS was that I didn't add enough value to the NHS and the surgical teams I worked in because I had children. So I'd say one of the biggest things is the support that you get within the aesthetics field. That very open-minded to all people and all backgrounds and all kind of like lifestyles, I guess. There's people that travel every week in aesthetics. That's not for me, because I obviously want to be at home with the kids. So I try and limit the amount of travel that I do to about once a month. Sometimes it's more, sometimes it's less, because there's kind of peak seasons in aesthetics. But in surgery, it was every day. There would be weeks where I didn't really see the children at all. And I think there wasn't support for that in a surgical training job. I often was told that it was silly that I wanted to be a surgeon if I'd already had children, or that my husband's career would always be more important than mine because I was the one that would have to go and look after the children. And those kinds of comments, just, I think when you're already feeling like you're up against it, feeling like your own supervisors don't then support you in and don't have your back in terms of where you're heading, that makes it feel very lonely.
Yeah, absolutely.
And I think a lot of females are really scared to have children. So I know a lot of the female fraternity within the surgical field that I was in very much just didn't have children, or they'd come to me and be like, I can't believe that you've done that, or I can't believe that you've tried to do that. And that's really sad. That's like a really sad thing for people to come and say. And that made me feel sad knowing that I guess from their point of view, been brave enough to have a child. But it's not brave, is it? It's just kind of something I wanted and I've decided to do.
Yeah.
I don't think anything should be more important than sacrificing your own happiness at the end of the day. And so I feel like that's probably the biggest difference, is the support and the open-mindedness to be whoever you want to be, regardless of whether you fit into that particular mold that they want you to.
Yeah, absolutely. And that you can build a business on your own terms and, yeah, make your own opportunities. Do you feel like if you'd stayed in the NHS working in the kind of surgical fields, the fact that you were a mother would have limited your opportunities and actually the way you could progress your career?
Yeah, definitely would. And it's interesting. I went to a recent event, it was only a couple of weekends ago, and across the room I saw this person and I had one of those moments where you're a little bit like, your stomach kind of like flips over, because I'm not, it was one of my old surgical trainers, and it was at an aesthetics event. And I had a moment where I was like, these worlds don't go together. Like, why is he here? Like, what is going on? Even though I'm completely out of the NHS.
Mm.
And I had a conversation with him while I was there. And I was really glad I'd seen him, actually. And he basically said to me, you are a fantastic surgeon, but I'm just really happy that you're happy at the end of the day, because you would have been so unhappy carrying on doing what you were doing. And it gave me so much peace. And I don't know why I'm still looking for like validation from surgeons.
Yeah.
I actually don't care anymore. But just having that conversation was like really quite validating for me.
Yeah, no, that totally makes sense. And if we go back to the beginning, when you stepped out of the NHS and you decided you were going to progress with aesthetics and you were going to set up your own practice, tell me a little bit about how, because it's still quite new, isn't it? Your practice, it's still a bit of a baby, your baby, you're nurturing, you're growing it. But how have you taken it from where it was at the very beginning to where it is now? What are the main things that you've kind of done? How did you, market yourself in those early days? How did you get patients, to find you and get your brand out there in your local community? What were the key things that you did?
So I actually started aesthetics about 8 years ago now. And I started when we lived in Bolton, because that's where we were based at the time. And I just had a home clinic. When I started out, it was really not very busy. The reason I got into aesthetics in the first place was because I had a maternity leave where I didn't get any maternity pay because it wasn't a training job at the time. And I thought, well, do you know what? Given that I'm not getting paid by the NHS, I'll go and do something that I really enjoy. And then, if something happens off the back of it, great. If it doesn't, then at least I've always said I want to try it. So that was how I actually started. And so I was still, after maternity, I went back full time into the NHS. And it didn't really feature that much. It was kind of the odd patient here and there. There was a bit of promotion, on Facebook and social media, but I didn't really put myself out there at all because it was never the planned career. The surgery was always the planned career. And then when I had my youngest, we moved back to where I grew up, which is Glossop, which is where I'm based now. And that was at the time a big thing. I remember my sister saying to me, oh, when you were growing up, you always said one day you're going to go and work in this particular hairdresser's and you're going to go and do the aesthetics from there. And then when we moved back to Glossop, I got a text off the woman that owns this hairdresser's basically saying that their aesthetics person had left and would I like to rent their room. And that very much felt like a huge step for me. I was like, oh my gosh, I'm going to rent a room at a hairdresser's. Oh my gosh, it's going to cost me £400 a month. Like, that's so much money. That's a massive overhead when you've not really got a business. And I remember being absolutely terrified. And I had this tiny room. Like when I say tiny, like you couldn't even walk around the bed. It was so small. And I remember being so proud, like the day that I set up there. And to be fair, the woman that owned the hairdresser was fantastic. She really did a lot of like grafting for me. So everybody that came into the hairdresser, she'd talk about me. So I think a lot of it came from her initially. And I think having more people come to me then from her gave me the confidence to think, oh, actually, I can do this. Like my results are quite good and blah, blah, blah. Anyway, I was with her for about 4 years. And the only reason I left was because she downsized and there wasn't room for me to stay with her. Otherwise, I would have stayed and I'd have been very happy there. But at the time, I still was in the NHS. And I spoke to my husband and I said, I'm going to have to find somewhere else. I'm probably going to have to go back fully into Glossop because I was just kind of on the outskirts. And I'm going to have to go and rent a room somewhere else. And my husband said, well, why don't you just see if you can get your own place? And I thought, well, that's a bit bold. You know, I'm still working in the NHS. Like, this is still not a career. This is just something I kind of do in my spare time, almost like holiday money. So I was like, that's a bit bold, it's a bit brazen, Paul. Like, I'm just not sure I'm up for that. I'm not a business person at the end of the day. So anyway, I had a look at some of the units and they were up for, some of them were up for maybe like £700 or £800. And by that point, that didn't sound so scary because £400 I was managing okay. So I thought, well, actually, do you know what? I potentially could do this. I potentially could make it work. And then maybe having a shop front would have a bit more authority in the town and a bit more footfall and a bit more. So all these other things I started thinking about. And anyway, looked at a few shops in Glossop and some of them were terrible, like mold, damp, you know, like I was like, I can't run a clinic out of here. Like I would rather die. And then I'd given up hope basically and just was resigned to just kind of packing up the business, maybe doing it back from home again. When my mum came out of an eyelash appointment and said, oh, my eyelash lady is basically knows somebody who's going to rent their property. It's been an accountant for 20 years and they're not actually taking viewings or anything yet. They need to renovate and this, that, and the other. And I said, oh, do you think they'll mind if I message them? So I messaged her and she was like, we can come and see it, but it is in quite a state. We've had like 20 years of 40-year-old men just kind of chilling in there. It is as you imagine.
Yeah.
And I went and looked and I was like, oh, the space is actually really good. And I took my husband and he was like, I think you could, my husband's really good at seeing past like the terribleness of things. Like when we renovated our house, he could see the potential and I was like, this is awful. And he was the same with the clinic space. So he was like, it's a great space. Like, I think you should go for it. So we basically just had a private arrangement. We didn't even go through anything formal. I just kind of was like, I'll take it off your hands when you're ready for me to take it. And it was very lucky. And I do think luck is a big part of this industry. And then we basically spent a little bit of time renovating it and it opened up. And then that was in the May. And then in the August, I handed my resignation into the NHS.
Wow.
So it was a pretty quick turnaround once I'd moved. But I think just having something, sounds really awful, but like tangible, as in like a shop front and a shop and a place, I think that was enough to make me realise that I could have this and it was all mine and I could build this however I wanted to build it. And like I said, I'd been thinking about it anyway, but this was kind of the push that I needed to, to get me there.
Amazing. And did the patient base that you'd built up when you'd been renting this space in this hairdressers, did they kind of follow you to the new place? You had a database, I guess, of patients?
Yeah, so everyone came with me. I maybe lost a couple of patients, and that was because they were travelling from like the other side of Manchester or like outside of Glossop. Anybody that was from within Glossop or like kind of the surrounding, they all stayed. If you've ever been to Glossop, it is the worst place to get in and out of. It's traffic-wise, it's so bad. So in some ways, we are limited in terms of people who are outside of Glossop don't love coming into Glossop because it's a bit of a nightmare. So I have a really good population that I kept within Glossop. And actually, I thought the limiting factor was always going to be the traffic. So people outside of Glossop would never travel to come in. And that's such a lie. Like, we have people coming from all over the place now, like the other side of Liverpool, St Helens, Stoke, Stafford, Lincoln, all over the place. And I was very much, my own limiting factor in thinking that I was only going to attract people from the local area. But yeah, so most of them came with me, which was beautiful and a blessing, really, because I think I'd have had a mild heart attack if I'd lost all my patients when I just opened up a new clinic.
Space. Did you see a big difference in the kind of amount of people who would, I guess, walk in and see you because you had that shop front, so people were walking past and seeing that you had a space and that they were able to walk into. And I guess it's better for your brand awareness because you've got like a
Yeah.
sign on the front of a building. Did
Yeah.
you notice
So
a big difference?
there was a massive increase in like terms of footfall and people seeing the premises. But when I moved, I also like kind of, not to be cheesy, but like elevated everything that I was doing.
Yeah.
So like my website got a redo, my branding got a redo, my socials all got a redo. And I think the website then was performing better as well, which I think helps. I think, Google website SEO and all of that is really quite important in business. So that all helped. And it runs where I am, I'm not actually on the high street. I'm kind of off the high street next to the train station, so it's really quite easy to get to if you're coming on a train. But it's the road runs across through to Sheffield that I'm on, so you do get a lot of traffic.
Mm-hmm.
And people said, "Oh, I didn't even know it was like a commercial property because it had been an accountant's until you put your signs up." And then I had to stop and see kind of what it was, and then I got home and Googled it. They're the kind of comments that I get. And then also I have a lot of connections within Glossop, as in other local businesses. So I've made really good connections with like some of the local hairdressers, with the local laser clinics. And we together have a really good partnership whereby if there's something that I don't treat, then I send it to the laser girl in Glossop, who's really well established. And if she's got any aesthetics, she sends it to me. Same with the hairdressers. If they've got any recommendations for aesthetics, they send it to me. And I send any of my patients over to them. So it works really well. And I think building those relationships in the community is really important. We do a lot in terms of charity work, and we really try and make ourselves known within Glossop itself. Obviously, I came from Glossop, so I feel partly like there's a vested interest in me giving back. So doing charity work in my local area is really not a problem for me. It also is really good for brand awareness. And I think people in the local area do read things like the local paper. That is still a thing here. So when you are in the local paper because you've supported a charity or you've done this or that, it is a good thing for brand awareness. So I think it's sometimes thinking outside the box about your marketing as well.
Yeah.
Not just your traditional social media stuff, which people get very caught up on. But I think there's more to it than that.
Absolutely. I always say to people, social media is great, but it's just one piece of a much larger puzzle. I think people
Yeah.
sometimes get a bit of tunnel vision with it, don't they? They don't really see anything else they could be doing. But, local building, community in your local area and those relationships is so important, and I think often overlooked by businesses or by clinics. How did you first go about building those relationships? Did you kind of go around and introduce yourself to people? Do you do any like referral schemes for their clients? And if they refer, they get a certain percentage?
So it started out as referral schemes, which worked really well in the early days. So if you refer, then you will get a code and basically you'll get 10% of whatever they spent within clinic back. So it worked really well from that point of view. But then it's weird, as time's gone on, that's kind of fallen by the wayside and it's just become like an organic sharing of it. Because I think everybody benefits so much that nobody's that bothered necessarily about the actual incentive of doing it, because every patient that's come to me from the laser girl has been happy, and vice versa. Every patient I've sent there has been happy, which helps both of us.
Yeah.
And she's probably the closest link up that I have. We definitely do. And she helps with charity work and stuff. We do have a lot of stuff that we do together. So I do think that side of thing is important. But initially, how I went about it, I reached out on socials and then went in with cupcakes to local businesses and said, I'm just going to leave these here, like, for your patients, your clients. One, so that they're aware of me, and also like it's a thank you to you for, entertaining the idea of a partnership. And like for some of the companies that I developed a venture partnership with, we sat down and had coffee, and we went out and had coffee, and it was very nice and informal and just chit-chatting. It was nice to see that the kind of people that are very aligned to how I practice and how I am, because I think sometimes it's really important to meet people if you don't necessarily know them, because you don't want to be referring people to, or referring your patients to somebody that's a bit cowboy, and you then have to apologize for their personality, I guess. So it was really nice to meet some of the businesses and see that they are very aligned to how I practice. And I think that's probably, those businesses are the ones that I think longer term are the ones that have been the most fruitful, rather than the ones that you just kind of exchanged a little bit on social media, the ones that we physically had interaction and contact. And interestingly now, I go to them as a patient. So I will go and have laser with her, and I will go and get my hair done with the hairdressers that I've got the venture partnership with, because it's in my best interest when I'm in there. People talk about me, people talk to me. Oh, you're Dr. Olivia.
Yeah.
I'm Dr. Olivia. Oh, I'd be interested in, well, yeah, come and book a consultation, no problem.
Yeah,
So you
yeah.
do, it's about, and I think it's really hard because sometimes you do want to go to these places and just be like, I just want my hair done. I just don't want to talk to anybody. But every time you're out in the public domain, like that is an opportunity to meet people and to build relationships. And I've got a really good friend in the aesthetics industry called Kate, and she said to me, every time you're out and about, you basically should be trying to work the room. And I was like, what does she mean by that? Like, that's such a strange thing. But she's right. Like, every opportunity is an opportunity to network and to meet people and to put yourself out there and to get people to know who you are. And I've gone from being not very good at like being a bit of a foghorn about the business to really trying to be proud of what we've achieved and the business that I've grown. And so I'm a lot happier to stand there and say, no, I did leave the NHS and this is what I do for a job. And I'm not ashamed that I left the NHS. And it's not abandoning the NHS, and my mum will get over it eventually. Like, I'm quite happy that this is my career. So she's actually given me some advice that she's given me lots of advice, but that's one of the bits of advice that I try and stick with on the day to day. And I do try and use, and I even have my kids at school, even the teachers come up to me and say, well, could I just come and see you in your clinic? And it's really interesting because I've obviously never mentioned at school, this is what I do. I always just say I'm a doctor. I don't say anything else. And I'm like, oh, it's interesting that there's and my kids don't go to school in my local area, they go slightly outside my local area. I'm like, oh, that's really interesting that like the marketing's actually reaching
The word's got that
even further afield. Yeah.
I want to ask you more about your marketing, but I really like what you said about how you've got the confidence now to go and put yourself out there and own what you do. What do you think has contributed to that? Like, how have you, because a lot of people talk to me about imposter syndrome and how, you know, they leave the NHS and, you know, or they're building their business while still working in the NHS. And they're like terrified of putting themselves out there on social media because they're like, oh my God, what are my colleagues going to think? You know, people will going to think, you know, what's this person doing? I'm supposed to be a doctor. You know, you should be in the hospital treating patients. Like, there's almost like a disconnect between aesthetics and like the medical community when you're working in the NHS, and you just fear that people think that you're not taking your job seriously. How did you get to the point where you were confident enough to just go out and shout about what you do and own what you do?
So initially I very much felt the same. It was very hush hush. Didn't tell anybody. This was very much side hustle. No one in the NHS knew about it. And then one of my colleagues who was a reg at the time, she had trained at the same training school that I'd trained in Manchester. And we started talking about it. Anyway, she basically blew the top on my secret in the NHS. Then I had lots of people coming to me and saying, I would love to know more about how you got into that. So I must have had within like lunch hour breaks in the NHS, meetings with probably like 5 or 6 different people in the hospitals I was working with, basically being like, how did you get into it? What do I do? I want to do this. Da, 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 da. And people, and I remember thinking, oh, this is really interesting because nobody is actually talking about it, but actually everybody wants to do it. And I remember sitting down with my supervisor. It was one of my last supervisory meetings before I left the NHS. And when you go to your supervisory meetings for like your basically sign off to say that you're competent, you have to write an up-to-date CV. And I thought, do you know what? I'm going to put everything on this CV, aesthetics, everything. Everything's going on this CV, all my surgical stuff, all my aesthetic stuff. And I went to this meeting and I sat down with him and he was like, you do a lot. And I was like, yeah, I do a lot. And he was like, and you do a lot outside of the NHS. And I was like, yeah, I do a lot outside of the NHS. And he was like, you need to take this off your CV if you're going to be taken seriously as a surgeon. And I was like, yeah, I don't care anymore. And then, like I said, within the next few months, I'd left. So but I thought, oh, that's really awful that something that I've grown to be quite proud of, that I've built all on my own without anybody's help, apart from my husband. And you think it's so awful that it needs actually removing from my CV because it's embarrassing to be a surgeon and do aesthetics. And I think a lot of that terminology, it's not good terminology, it's not positive terminology, and it doesn't make you feel good. And so I just got to the point after that where I was like, I actually don't give a flying, you know what, about it. I just don't get it. Got to the point where I was that pleased with what I'd achieved, even though it was still really small scale, that I did not care what they thought about
Yeah.
me. And it's really hard because I think when you work, it's easy when you're a surgical trainee, you move around every 6 months, you're in a new team every 6 months. I think when you're a nurse, I think it's harder because you're often in the same team for quite a long period of time. So I think if you are scared of upsetting the apple cart in your like regular team, that's more of an issue. Whereas I was like, well, I'm moving in a couple of weeks, so it doesn't matter to me. And then obviously ended up leaving, so it really didn't matter to me. But I think you've just got to be confident in what you're doing. And you've got to understand that like it is a huge achievement to build something by yourself, away from everything that you've ever known, away from all safety blankets, safety nets, people telling you that you're great in the NHS. The NHS needs you, yes it does, but also you need to be happy. And so you should be proud that you've managed to forge, even if it's just like a crack of like light coming through, that you're working towards something that's going to make you happy longer term.
Yeah.
And once I'd realised that, I was quite happy to shout about it. I'm still not the biggest shout. There's people that shout louder than me, but I'm quite happy within the right settings to talk about what I do and how passionate I am about it and the great things that we do. Because it's not just aesthetics, and aesthetics is horrendously misunderstood by most people looking from the outside in. It's just fillers and Botox to most people, but it's not. Like the clinic does pro bono work for cleft lips. It does free skin clinics for all the local teens in the community. It works with DFID charities to help support DFIDs within the local community. Like it does loads of different things, but you know, people view it as just aesthetics. So, and that's a perception problem.
Yeah. Even the treatments are more than just fillers and Botox, you know, it's literally empowering people to, you know, regain their confidence and, you know, carry themselves, you know, if they've been dealing with some insecurities around the way that they're aging or their appearance, or, you know, like you say, things like cleft lips, when you can give people like the tools to look and feel their best, it can be life-changing to a lot of people.
Yeah. Our tagline in clinic is "we inject confidence." Like that is our tagline, because that's very much what we try and do. So regardless of why patients don't have confidence, whether that's, you know, scarring, like birth defects, whether that's changes due to like things like menopause, where people have a dissociation between what they look like and how they feel, whether that is a life trauma like a grievance or a divorce, or you know, child's moving away and they don't really know where they sit anymore, any of those reasons and more basically knock your confidence, and we're just there to try and help you feel better in your own skin so that you can face life in whatever way it makes you happy again, I guess. And that's a really powerful position to be in. And patients are happy when they come to see me. Patients in the NHS were not happy to see me. Patients, when they come and see me in aesthetics, are really happy to see me because they know that I can do something that's going to give them a better quality of life. And there's a lot to be said for that. And I think it's completely undervalued and overlooked.
Absolutely. And you can choose the way you care for those patients as well. You can choose how much time you spend with them and how much time you can give them. Just going back to the marketing side of things again, what would you say has been the most powerful tool for getting new patients in the clinic? I guess obviously we've talked about your connections within the local community. That sounds like it's had a big part to play. Digitally, does your social media bring a lot of patients? How do you approach your kind of digital marketing?
So everything at the moment is currently done by me, which is a tall ask, which means it's inconsistent at the best of times, but it's authentic. And patients like authenticity, patients like believing in you and knowing you. And there's some ridiculous research, I think, somewhere that's like patients have to see you something like 8 hours worth of time before they'll buy into whatever you've got to offer them. And I think that's really important when you're starting out as well, because I think when you start marketing yourself, you film these videos and oh my God, I must have filmed something like 10 times before I put them online. And now I'm not sure, I don't have time to refilm this 10 times. Like, you get what you get. But it's funny. It's funny when I slip up, or it's funny when it's not quite right, or I don't mind. I'm okay. I'm a human. I'm okay to not get it right all the time. So I'm a lot happier and a lot more lax about what I put online now. There's a bit of personal stuff that goes on there. There's obviously business stuff. There's behind the scenes. There's funny stuff. There's me messing up. I'm happy to be human and just put that out there. I don't know if you had to ask me honestly what is more powerful within the business as it currently stands. I think I'm on a very 50-50 split between word of mouth and social media. And a lot of the word of mouth comes from kind of like refer a friend schemes and patients genuinely just thinking that they've had a really good experience and wanting to share that with family, friends, loved ones. A lot of people will buy vouchers for friends and family, usually for the skin therapist, but then that kind of like works its way across to me. And so it's very difficult to know which it is, because I think we're probably at a 50-50 split at the moment, so when people are very much, social media is everything social, it is very important, obviously, to have a presence online. People want to buy into you, people want to believe in you, people want to know that you know what you're talking about and that you've got that kind of authority within the industry. Totally get that. I'm the same. I go and stalk people's social medias all the time before I go and buy into them. But then there's something really powerful about having a personal recommendation. And if someone personally recommended somebody to me, I would pick that person 100 times over everybody else, even if I'd stalked their social media. So there's a lot to be said for people trusting other people and other relationships. And effectively, all we do in aesthetics is build relationships. That's the majority of what it's about. Is we build relationships with patients, we build relationships with other businesses, we build relationships with our suppliers. So I feel like the whole industry is built on relationships, and it's not really any different for patients when they come in. They've got relationships and they've got their own network that they trust. So they will use that information, they will feed that information to parts of their network. The other hilarious thing is I sometimes have families of patients that have come in that have all come through other people recommending them, but not each other, and they don't know that each other come to the clinic.
Wow.
But they'll be like, oh, it's really interesting. Oh, that person, and it'll be like a cousin.
Yeah.
Well, actually, that cousin recommended me, and they'll all the sisters will sit and be like, oh, the cousin recommended you, but like my sisters don't know I'm here, and I'm like, okay. And they're all the same. It's really interesting, but like it's interesting that some people really value word of mouth and some people wouldn't share that information. And I always say to my patients, I am fully aware that I am everybody's best kept secret. Like asking for reviews is like pulling teeth with my patients, because obviously they have to put their name on Google when they put a review. That's okay. Like I don't mind. I had a patient the other day that said to me, yeah, there's not many like before and afters of your Botox on social media. And I said, well, there's a couple of things to unpick here. The first thing is a lot of my patients don't love being on social media because it's a very personal thing, natural results. They don't really want people to know they've had anything done. Secondly, advertising Botox on social media is against prescribing and advertising standards. So that's why it's not on there. And she's like, that makes so much sense now. She's like, I wouldn't want my pictures on social media. And I was like, exactly. That's exactly the point. So when there's not necessarily a lot of before and afters, there's usually a reason why. It's usually because they're actually quite a good practitioner that are respecting the patient confidentiality and patient wishes, rather than patients not truly and thoroughly having informed consent to put stuff on social media and ended up on social media anyway.
Yeah. So, I think a lot of people get caught up as well, don't they, in the idea that they need to be putting lots of before and after photos out there, especially in those early days. But actually just putting yourself out there and giving value and educating and positioning yourself as like a trusted expert in the content that you're delivering can be, good enough. And I agree. I think patient referrals are probably the strongest marketing tool that you can have, because if someone refers someone, that person is already going to trust you because they trust their friend or their family member who's referred you. There's going to be less of an inquiry process. They're probably just going to want to come in and speak to you. And they're probably going to be a lot easier to convert into a paying patient as well. So yeah, referrals I think are so important.
And just going back to what you just said there about converting them, like from consultation, we have a 99% conversion rate because of that, because the work's already been done by the time the patient walks through the door. Like as soon as that patient books that appointment, they already know they're having a treatment.
Yeah.
Because we've done so much education online, so much educating of our other patients and, friends, family for those patients, stuff in the community. So the hard work's already been done way before the patient even arrives in clinic.
Yeah, it's so important. And just moving away from kind of marketing, something I wanted to ask you about is your kind of research and education in aesthetics. So you founded the Northwest Aesthetics Research Group, which brings practitioners together to discuss, critique and collaborate. What inspired you to set this up?
So again, going back to surgery, we have journal clubs quite a lot in surgical training where we look at the latest publications and we sit together, or like not just the latest ones, but like the very famous ones that kind of change clinical practice. So we'd sit down and we'd discuss them and we'd say like what good things there were about the article, all the research, great massive cohort of patients, multiple centres, those kind of things, versus the bad things. Oh, well, it's not statistically significant, or it's not really going to change my practice because X, Y, and Z. And I thought they're really quite useful in a surgical setting because they really do change your practice, and you have an opportunity to discuss with like-minded people about what they're seeing in their practice and whether they would change their practice based on the evidence that's put in front of you. Because it's really easy to get really tunnel vision. It's really easy as a lone practitioner to think that your way is the only way and the right way all the time, and it's not. There are millions of ways to skin a cat, and I believe that in aesthetics, I believe that in surgery and everything else. And it's interesting to sit with other people and get their points of view based on their own experiences, because they will be different to yours. And I sat there and I thought, I don't understand why this isn't being done more in aesthetics, because there's so many different ways to do things. Like, you talk about all these different techniques, like tenting and linear threading and cannula. You talk about all these different techniques, and actually, is there a right one, or are they all good, or are they all as effective? Are there more complications with one more than another? Like, who's sitting down and actually looking at all this and having a conversation about it? And there just wasn't much out there when I set it up. And so I basically reached out to, I don't want to say like random people, but it was basically people that I'd seen on social media who were, I don't want to say outspoken, but happy to speak out about things that they weren't happy with. And some were people that I knew more personally. Some were people that I wanted to network with, as in I wanted to build a relationship with. So I basically built like a little network, and there was 10 of us to begin with, all varying specialities, some nurses, some doctors, some dentists. And we sat down and we basically, it's all run basically on WhatsApp. It's very low tech. And it's basically me putting a survey out being like, what date suits you? And then me putting a survey out being like, what topic do we want to try and find a paper on to discuss? So there was a paper about Botox causing vascular occlusion a while back. And I was like, would we be interested in discussing that? Because it might be a moot point for patients to talk about, and education and this, that, and the other. And then there was a paper on, one of them was on like probiotics. One was on, trying to think of the ones that we looked at now, collagen supplements, because that was quite a big thing at the time about whether the evidence was actually any good at all.
Yeah.
So those kind of topics, those kind of ones which sit on the periphery of your practice, but can affect patient outcomes potentially quite a lot. So they were the things that we focused on, and it was basically, which topic do you want to talk about? And then I'd go away and find a few papers, and I'd say, these are the papers, have a read of them, come back together, and then we basically go through it and discuss our feelings on it, our views on it, what we think was good about the paper, what we think was bad, whether the paper would change our practice in any way, whether it would make us rethink a product that we're potentially bringing into clinic. I know one of the girls that we did the collagen one, it's taken her a year to bring a product into clinic now regarding collagen, because she's had to do so much extra research on it because of the paper that we discussed. So yeah, it was quite worthwhile. It's been worthwhile for me because I've built some really good relationships. And I think, as I said before, aesthetics can be a really lonely industry when you're a sole practitioner. So having a network anyway is really good. And it means if, for example, I had ever had a complication or a problem or something I'd not seen before, I have 9 other people to reach out to with different expertise than me, who potentially have seen it before when I've not, or have different ideas to what I have. So it's not just necessarily about the publications and the research and the discussing that. It's about having a group of people that you can rely on no matter what. And these people are fantastic people, and I do rely on them quite a lot for clinical advice. And it's almost like our MDT is what I would call it, like an aesthetics MDT, where you've got people from multi-disciplines and you're coming together to explore best patient outcomes overall.
Yeah, that's nice. It is nice to have a community because, like you say, it's you go from working in a team in the NHS to suddenly working on your own, and it can feel very daunting, and you've not got anyone to kind of go to for advice. So yeah, that's nice. For practitioners who are working alone at the moment, or perhaps in that initial stage of setting up their practice, what advice would you give them to find support and community?
So when I first started out in aesthetics, I worked for a training academy, and I used to always say to the delegates I had on that course, take each other's numbers, even if you live miles away from each other, take each other's numbers, set up a WhatsApp group, and just at least start having those conversations with regards to any patients that you see. Because when you're really early on in your practice, you don't know what's normal, you don't know what's not normal. And so you learn the most learning through other people's mistakes as well. So if you can look on, there's loads of groups on Facebook and Instagram about complications that are ongoing in the industry, learning from other people's mistakes. What people would recommend is usually really good practitioners that have commented some plans and things like that. There's complications groups. So there's now big, I say companies, but that basically work on managing complications. The CMAC, they do a conference every year. They've got a great group of people. They support people with complications. So you don't have to go and have and go hardcore and go and join CMAC straight away. But it's useful to have a group of people that you can bounce ideas off. And I normally say, if you can, very early days, find some people. I've got people local to me. Like, there's a girl who's down the road. She's an intensive care nurse, brilliant aesthetics practitioner, got a clinic on the high street. People be like, oh, competitor, absolutely no way. We have a great relationship. She comes to me, I go to her. I actually got vouchers for her for my birthday from one of my friends. No offense taken by me. Do you know what I mean? Like, she's a great practitioner. And she rings me, I've run out of this. Have you got any in? Yeah, of course I do. Come and get it. Like, it is so important to have people close by. And I think people really overthink competition. And actually, you could use any competition as an ally, in my personal opinion. And I'm not saying that you have to be best friends with everybody, but I don't think having good relationships with people locally is a bad thing. And I think having any kind of network to support you in this industry is a good thing, because it is very cutthroat. There are lots of people, like I've seen in one of my WhatsApp groups that I'm on, there's been a lot of talk this week about lots of people that kind of sit on the top. People are trying to take a chunk out of them for some of the things that they've posted online. And like we say, it's really quite awful. Like, I wouldn't want to sit at the top, because I don't want to be in a position where people want to bring me down all the time. But it's also really interesting to have a group of people where you can have a conversation about that and say, well, actually, though, the evidence that they've put forward isn't great. So they, rightly so, people are trying to have a prop and say something about that. But I have loads of little WhatsApp groups with loads of different practitioners, all that offer different bits of advice. Some are more business focused, some are a bit more like moaning about social media and about the media and marketing and all that kind of thing. Some are a bit more like clinical focused, some are a bit more research focused. They're all very different. And that comes with time, obviously. But I think if you can get maybe 3 or 4 people that are relatively close by, like within a 50-mile radius, would be great. So that if you really did have a problem, someone could come and help you out. That's absolutely the way forward, in my opinion. I think you'll save yourself so much heartache and headache if you just have somebody that you can message about something. And I always say to people, my inbox is open, so if you're really stuffed, please message me. I'll happily help. So anybody at me, I'm always like, yeah, just message me. I'll help you if I can.
Yeah. Oh, no, that's really nice. And I actually had a conversation with someone else who's come on recently as a guest, and we were talking about this and how it's also important to have these relationships, because when you go away on holiday, if something happens to one of your patients, you've got someone who you know who's close by that can perhaps help, and vice versa. And just having that peace of mind that you've got those things in place should the worst happen.
Yeah, I'm really like an overcautious practitioner anyway, so I don't do dermal filler for the couple of weeks before I go away, because I'm just so uncomfortable with the idea of leaving a patient hanging. Same with Christmas, so I stop all filler appointments from the 14th of December every year, because the idea of a patient having a problem over Christmas and it ruining their Christmas and it ruining mine.
Yeah.
And I've been in the situation where I've been clearing up other people's problems over a Christmas period, and I don't ever want to put my patients in that situation or somebody else in that situation for me. So I'm particularly over the top with my guidance around holidays and things like that. But yes, that is where these networks are really useful, because somebody would be able to step in and help you.
Yeah,
I'm just too
absolutely.
much of a control freak, is my problem.
No, I can understand though the thinking behind that. And actually, let's talk about that. That leads us on nicely to my next question, because one of the most incredible things you've done is you've started offering a service where you treat emergency aesthetic complications, even when a patient has come to you from elsewhere. And that did start because of someone who came to you on Christmas Eve. Can you tell me a little bit about the story behind that?
Yeah, so it was a patient that had non-surgical rhinoplasty, so filler in the nose elsewhere, obviously, in the lead up to Christmas. So I think it was the week before Christmas. And the patient had basically had some unusual side effects, been back to the injector, and the injector said, everything's fine. And then a couple of days later, things had gotten worse again. And she said, I don't think this is fine. And the practitioner said, well, I'm off for Christmas now, so I can't treat you, I can't see you. So this then fell on the 24th of December, like it does. Bear in mind, I'd stopped all my appointments on the 14th, thinking I'm going to have a nice, clear Christmas. And this patient reached out to me and said, I'm really sorry to bother you. I know it's Christmas Eve, but I'm really panicking about my nose. it doesn't look right. I don't think it's normal. It's painful. And she sent some pictures over, and my Instagram still it was on Instagram, and my Instagram still flags. I still get like on-screen notifications when people send me messages. And I showed the start of the message to my husband. He was like, "Don't read it." He was like, "Don't read it." I was like, "I can't not read it, Paul. Like if it's something that I can help with, I have to read it." So like we'd had this like falling out about it before I even read the message, because he knew what was coming. And I read the message, and it was basically, it was bad. It was really bad vascular occlusion, end of the nose, tracking up the nose. She had like pustules and like tissue breakdown at the end of the nose by the time she came in. And I basically said, "Where do you live?" And she was like, "I live about 25 minutes away from you." And I was like, "Right, drive over, I'll meet you at clinic." So it was about 11 o'clock in the morning at this point in time. So got in the car, went to clinic, met her in clinic, and dissolved it obviously straight away. She had lots of highlights to dissolve it. And then I explained that, it's going to be a bit sore and it's going to be really sore for the next few days, but I'll need to review her kind of every other day just to make sure things are okay over this period. So on Christmas morning, she sent me some photos and things were looking a lot better, even though she was very swollen and bruised. Sent me some videos of her capillary refill, which is the thing that we do to check blood flow, and everything in terms of like the tissue changes, the mottling and things had all started to settle down, which was great. And then I reviewed her on Boxing Day. So she came back into clinic on Boxing Day and I was much happier. There was like a small amount of like tissue that was still slightly non-responsive. So we put a little bit more Hyleas in at that point. And then I reviewed her again 2 days later. And this went on for around 2 weeks. So kind of all through Christmas, all through New Year. And yeah, so from the back of that, I basically decided that I would treat patients free of charge if they had been treated elsewhere and had a emergency complication, and that I would treat them in clinic free of charge. Because as much as it's not my problem, correct, it's not my problem if a patient's gone somewhere else and had a bad treatment, it's also negligent, in my opinion, if I don't then do something when I know that I've got the skills to help. So I think duties as a doctor, the first one is do no harm, but also you are doing harm if you don't do anything as well, is my opinion on this. But it's also, should it be my responsibility to foot the bill for these patients that have complications? Probably not. But also, how many do I really see? And I'll probably see more now. I'll bloody put this out there. But in terms of how many we actually see, it's probably only a handful each year. So, your Hyleas is what, like 30 or 40 quid? It's really not going to be the difference between my business going bust and not, but it's potentially the difference between a patient's face and not. And it's hard because you sit there from a business point of view, and me and my husband do still argue about this particular patient, because he very much feels like business-wise it makes no sense to do this. But also because his argument is the patient's probably never going to have a treatment again because they're so emotionally scarred and physically scarred from the experience that they've had.
Yeah.
True. I said, but my argument to that is, but potentially they may tell somebody else what a great experience they've had from me, who may be considering a treatment, and that may be a patient that then gets referred in to me. And he said, yes, but the cost of the product and this, that, and the other. And I said, well, I have to stock the product anyway because of emergencies. So it's not really like it's only going to go out of date, like the amount of Hyleas that I throw away each year because it goes out of date. So in my opinion, I think it's a worthwhile thing to do, and it makes me sleep better at night knowing that
Absolutely.
the complications in and around Glossop are taken care of regardless of whether a patient can afford to have a dissolve, because if they were getting charged a dissolve by me, it'd be £400. Most patients can't afford that, which is why they've gone and had a treatment done cheaper elsewhere in the first place. So I feel better knowing that that is something that I can do for patients and that I can protect the patients within my little community as much as possible.
I mean, I think it's amazing, and I guess I can understand exactly where you're coming from, where you say you kind of feel like, you're obliged to, because in that situation, what is the patient supposed to do? They go to A&E, they can't be treated there.
Exactly.
Who did the treatment doesn't want to know about it, and also if they're a non-medic, probably doesn't have the Hyleas to dissolve the filler in the first place. So
and I think if as soon as you are involved in that situation, so granted, if I hadn't read the message, fine, I could probably be excused, even from a legal point of view, because I hadn't read it. But as soon as you know about that as a problem, legally, I think you'd really struggle to stand up and say, oh, well, it's not really my problem. I just think you would. I think the GMC would probably have a lot to say about that if they found out that you knew that there was a potential problem. and you made no steps to try and resolve that, whether it was a trip to A&E, whether it was a trip to another practitioner, whatever. But if you didn't do something, I don't think the GMC would think of that favourably, in my opinion. But I'm very black and white about these things. And like I said, I'm a very risk-averse practitioner anyway. So I will always err on the side of safest practice.
Yeah.
And for me, that is always to intervene and treat.
Yeah. And obviously, as we've just touched on, not all practitioners are willing to take responsibility for their patients in situations like this. How do you think we can kind of raise industry standards so that more practitioners take accountability for complications?
I think that's hard because I think it's an individual basis. I think it's previous experience. I think you do have practitioners that think, well, I've never had a vascular occlusion, therefore it's not going to be my problem. And my answer to that would always be, if you are injecting enough, you are going to have one. I've never had one, but I am not stupid enough to think that I'm not going to get one, because I 100% will. So I think it's about talking about it, normalising vascular occlusions, because I think people think you're a bad practitioner if you caused a vascular occlusion. I don't think that's the case. I think, like I said, anybody can cause a vascular occlusion. I think it's how it's managed in the aftermath and how responsive the practitioner is to treating a complication that is a true sign of the person that you're dealing with. So I think if we normalise it more, talk about it more in the industry, and not make people feel like they are incompetent because they caused one, then I think we'll probably get a lot further in increasing patient safety. And I've already talked about things like CMAC, which is the Complications Management Group. They are fantastic at what they do. They publish a lot of data and literature on complications. They're headed up by some fantastic specialists where they're like niche bit of research is in things like hyalase, the dissolving agent. So they are a great group to follow as well, just for advice. They've got their own protocols and loads of information, like loads of free information as well that you can gain from them. So I think as a practitioner, you've got to educate yourself, and you've got to not be naive enough to think that it's not going to happen to you. And you've got to be happy that if that situation arises, do you actually know how to treat it, or are you just going to panic? In which case you need somebody else who is competent and happy to help you treat, in which case where that little bubble we talked about and that network is useful, because two of you is always going to be better than one. You on your own will panic. You with somebody else might not panic quite so much. And I think from a patient point of view, I think the amount of times I've seen a patient in clinic where they've been elsewhere for treatments and I've sat down and said, there is a risk of filler getting into a blood vessel, affecting the blood flow to the tissues, and that potentially causing permanent scarring or filler blindness. And the patient's like, are you joking? I've been having my lips on for 5 years, someone else no one's ever mentioned that to me. And you think, wow, like that's not informed consent. Like that patient has not consented to that procedure. From a litigation point of view, that is horrendous. And again, very surgical, like informed consent's a big thing for me, because I wouldn't be operating on a patient without informed consent. So for me, it's really important that we are really informing the patients of the potential risks. And I know they're not nice risks. Like I don't want to talk to my patients about potentially causing them to be blind. But if you explain to patients, it's low risk. However, it is a potential possibility. It's been reported in the literature. There's these many cases of it. This is the percentage of it occurring. Your patients then get the opportunity to make that decision themselves. The last thing a patient ever wants is to feel like they've been pushed into something they've not actually had a chance to have an opinion on it or the choice. And that's when you get yourself in hot water as a practitioner, I think, when you've taken that option away from the patient.
Yeah, when something does go wrong, which they had no idea was even, a potential side
Absolutely.
effect.
Yeah.
So touching on another side of what you do, you also train for Dermafocus, and you do a lot of speaking at conferences, both nationally and internationally. What do you love the most about training?
I think I missed it the most when I left the NHS. I used to love training more junior surgery or surgeons or doctors in the NHS. It was one of the big things I was passionate about. I grew up being a trainer, so I was a gymnastics coach from the age of 14. So it's always been a huge part of me and what I enjoy. So when I went into the NHS, I naturally sought out roles where I was teaching. I used to teach the medical students and things like that. And then when I got into surgical training, there was mentoring programs for that again. But then as the time pressures got more and more in the NHS, there was less time to teach. So there was more time to, I'd say less time to do everything. So it was just basically more doing, less teaching. And it became very much like a see one, do one, teach one kind of, rather than actually sitting down and having formalised sessions on things. And I struggled with that quite a lot, because I liked that interaction, that one-to-one time. I liked that more formalised setup for teaching. So when I left the NHS, I immediately saw a teaching opportunity. So I went to train for a training academy in Manchester, like I've talked about, and stayed with them for 4 or 5 years. Really enjoyed training other injectors, newbie injectors, passing on all the pearls of wisdom that I wish people had told me when I first started out. And then when I went and moved to Derm Focus to be faculty for them, it kind of felt like a massive level up in terms of the education that I was able to give, because we are the products within the Derm Focus range. If you don't know, they're regenerative products, so they work to basically reverse the aging process and make the cells work at a better cellular age, better function. So there's a lot of science with it, which I obviously love. It goes really hand in hand with kind of like the evidence-based background, the research, and that side of things. So it's a really nice fit for me. So in terms of the training that I get to do and the speaking that I get to do, there's a lot of science in it. And one of the key things that I try and do, like my tagline in clinic is injecting confidence, my kind of tagline for speaking is to make science accessible for everybody, so that even if you don't come from a very heavily dominant science background like I do with a PhD and a surgical background, that you will be able to access and understand the science behind some of these newer cutting edge treatments. And it is a lot of fun. The company's a great company to work for. Like I've said before, the faculty are so much experience within the faculty, and I learn every time I'm with them. And it's nice because you still get newbie injectors, because a lot of people are coming in through the regenerative route now, and then you still get some really experienced injectors that you get to work alongside as well, and you get to, give them new skills, so you get to help them upskill, which is a really exciting thing to do when they're already kind of on their way in their journey of aesthetics.
Yeah, absolutely. And you mentioned that you really enjoy teaching people the things that you wish you were taught at the start of your journey when you were entering kind of aesthetics. Do you think there are gaps in how aesthetic practitioners are being trained right now?
I don't think there's enough on the business. So
Mm.
dentists are probably the only exception to this. So dentists do have a little bit of business knowledge, because they usually come from an NHS private split within their dental practice.
Mm.
Not all of them, but some of them have obviously had that experience. So they've been able to get their heads around the conversation of taking money from a patient, telling a patient how much things cost, discussing a price with a patient, discussing a treatment cost with a patient, all these kind of things, where in the NHS, that doesn't happen. So nurses and doctors are terrible at it. I still am terrible at it. So a patient will say, well, how much is it? And I'll be like, it's £800 for 3 sessions. Or if a patient pays you in cash and they're like, just count it for me. I'm no, it's fine. Like, just not, it's just terrible. We're just terrible at it. So I feel like business lessons early would be great in terms of academies and things like that. And there's a lot more mentorship programs that focus a lot more on the business side, but very early on, just things like how to set up a business. Should I be a sole trader or should be a limited company? Do I need to get an accountant? Like, do I need information commissions officer sign off? Do I need PHS to come and collect my shop? Like, really stupid things. Or you may feel really stupid at the time when you're very newbie, but things that like are almost the expectation that you will have if you're running a business. And they're things that you will know nothing about, because you've never run a business, you've never been in business, you've never talked about money, you've never set up a standard operating procedure for anything, you've never run a private clinical audit. So all of these kind of things, it'd be really helpful if more academies would push that side of things, because I think it's even stuff like ordering from pharmacy. I mean, it's a headache at the best of times. I order everything on stock. It's harder for me to follow the rules than it is to break them in terms of ordering stock. So like, you could very easily as a new practitioner slip up and find yourself in hot water with that, with prescribing guidance. And like we talked about advertising standards with Botox, there's just loads of nuances within the industry. And I think because it's so heavily unregulated, people think that they can get away with all of these things. And actually you can't, because you're still governed by either the NMC, the GDC, the GMC. And so you'll come unstuck at some point if you don't try and work to the best standards, when that's both in a business sense and a clinical sense. So I do wish that academies would take it a bit more seriously from a business point of view. I actually think the injecting is probably the easy bit in terms of running a business, and it's taken a lot for me to get to grips with business strategy, planning, building, growing, future planning. It's been a challenge, and it's still a challenge. It's still the thing I struggle with the most, and I rely, like I talked about, my husband's usually the person that's my sounding board, and I rely on him a lot to just like sound check me effectively on some of this stuff. Like when I'm going to buy an 100 gram bit of kit, do I actually need this? Like, this doesn't feel very sensible. This is like more than our house is worth, like that kind of thing. Do you know what I mean? It's so much money. And I do think in business things become a bit silly. Like, it becomes a bit like monopoly money because it's like business
Mm,
money.
yeah.
So I wish people would talk about it more. I really try to every viewpoint that I give in terms of, even when I'm training for Dermafocus, I'm talking specifically about products. It's always about how can you deliver that into your clinic and make it financially viable, because
Mm,
ultimately it's just a hobby if it's not financially
yeah.
viable for you. It's not a business, it's not a career, it's not job security, it's not family security. And I think people forget that sometimes, and academies specifically don't
Yeah.
focus on that enough.
Yeah. No, that's so true. And I think that's probably, yes, so important when you have your initial training. Like you say, injecting is probably the easiest part. You get those skills, and then if you're not going away and you don't have people to kind of treat, then you forget it all, and you're not going to be
Mm.
confident anymore in treating those, because you had the training and then you've not applied that training enough in your clinic. So yeah, that I completely understand why that's something that is important and is, very necessary.
And people often will do a training course and then they'll sit on the skills that they've learned
Mm,
for a little while. And that's the worst thing you can do when you start out. Like, the amount of people that I saw at the training academy I used to train for, who would come back a year later for a refresher course, having not injected anybody, but spending another £500 on a refresher course.
yeah.
Like, you just don't need to. Like, nobody, it's like learning to drive. Nobody goes into aesthetics knowing what they're doing particularly. It's very much a learning curve. The more patients, the more family that you can treat early on, the better, because you will just feel much more comfortable gaining those skills. And it's a saturated market already. Like, there's enough room for everybody, but you do have to get on and crack on with it. You can't just think, oh, it'll all be okay, like I'll get around to it at some point. Like, you just won't. When nobody's there watching you and helping you, you just won't do it. You have to
Mm,
have people lined up from the second you leave that training session, ready to go in. And it gets easier, obviously, the more experienced you are. So, like, when I learn things like polynucleotides, for example, well, that is pretty straightforward when I've got a host of 600 patients at the clinic, for example.
yeah.
Just put an offer on and people will come. And it's
Yeah.
not particularly complex treatment. But when you're first starting out, you don't have that client basis to do that. So try and find people that are happy to be your models to begin with, just so that you can
Mm,
gain some confidence, if nothing
yeah,
else.
absolutely. And now kind of your clinic is thriving, and you mentioned to me prior to this discussion that you are thinking about franchising. What has the journey been like? How have you kind of come to that stage?
So I had a really good conversation with a friend of mine who basically, she said to me, like, it's what you want at the end of it. And I was like, oh, I don't really know what I want at the end of it. And she was like, well, do you want to work forever? Do you want to retire at 50? Do you want something to sell at the end of it? Like, what do you want? And I was like, well, ideally, I'd have something that I would sell at the end of it that would be my retirement fund, effectively, like a brand, a business. And so I thought about, is it easier to grow a single site? And I was like, well, I'm very limited because we are a small town in Glossop, and people, granted, are travelling to me. But I think it would be easier to grow if there was a second site with a second population pool, potentially maybe an hour away. In my head, an hour's, if I
Mm,
was a patient, I probably wouldn't want to travel more than an hour. So it's probably unlikely to dilute the population group that I've got currently. So then it was a game of, where can I expand within an hour's radius? So that's how it started. And the idea at the end of it is to build something where there's something tangible, that's
mm,
saleable or sellable at the end of it. That's the idea.
yeah.
Whether that happens or not, who knows? Business is business. But that's the plan.
Yeah. And you've got that kind of to work towards, I guess.
Yeah,
Yeah, over the coming years.
absolutely.
Yeah. So for practitioners looking to grow their business or get involved in research or improve their patient care, what's the biggest advice that you would give them?
I'd say you do have to take risks, and I'm not a risk taker, as you probably learned through this conversation, but you do have to take some risks in this industry to grow. Do you have to put yourself out there to grow? And whether that is in terms of growing and
Mm,
franchising, like, you have to put yourself out there to test the water to see whether people would travel elsewhere. Whether that is in terms of going and speaking on stages, I wouldn't have had the opportunities I've had if I'd not put myself out there and networked with the right people and kind of said that I'm happy to give anything a go even though inside I did not want to give anything a go. In terms of science and training, you can approach training academies if it's something you want to go and train. If you want to go and be faculty, then it's about approaching companies that you're aligned with. And I got approached by quite a few companies very early on in my aesthetics career that didn't necessarily align with who I was and kind of where I wanted the business to go and the ethos of the business to be. For example, I talk quite a lot about CE mark, FDA approval, again, all related to science, especially for filler products, because they're the ones that are closest to being an implant that's in your body can be anything up to 18 months. So I very much treat them like a surgical implant. And I got approached by a company that was a non-FDA, non-CE marked filler company. They wanted me to be a KOL for them. And they were a great company, good people. They make fantastic skincare products that I happily will use, but they don't have that caliber of filler that I want to be using in my clinic, and I want my patients to have the best. That's a really hard conversation to have with people, to say, you're just not going in the direction that I need you to go in to work with you. So I would say if you're looking to do kind of like KOLing, faculty, that kind of thing, pick a company that aligns with what you believe in and where you can see the business going, and play the long game. Don't just play the short game and take anything or the quickest win, because what you don't want to be is somebody that jumps between companies. Like I know people that do, and people then say, well, will she just go to the next company that pays her the most money, or will she just go to the next filler company that X, Y, and Z? So pick people that you really can be aligned to and that you think there's a real longevity in that relationship. And for me, Dermafocus is that. And a lot of people are KOLs for multiple different companies, but I'm happy with where I am right now. And this was a relationship that was built over several years, and they've given me a lot of value, and I hope I've given them a lot of value. So I'd say don't just rush to be a KOL for anybody, because longer term it could actually hinder you rather than help you. And in terms of if you want to go and work for a training academy, there are loads of really good ones. There's London-based ones like Harley Academy, there's ones all over the country like Acquisition Aesthetics, there's ones up in the north like Skin Viva. They will all take people on as trainers. So if that's something that you're super interested in about, bringing on the next generation of injectors, or you just miss training because you don't get to do it anymore like you used to in the NHS, that's a really good way to enjoy aesthetics in that kind of format. And it's really good from a stability of income. So if you're on that cusp of leaving the NHS, it's really good. You can have a couple of days in a training school where you know that you're guaranteed a certain amount of money, knowing that you can kind of spread your wings and leave the NHS without fully having to rely on your own clinic income.
Yeah, absolutely. That's quite nice to have to fall back on. Yeah,
absolutely.
Yeah. Oh, this has been such a lovely chat. You've given so much great advice, and it's been so inspiring.
Thank you for
hearing your
having me.
story. No, thank you so much for
Thank
coming on.
you.
It's been a real pleasure. But before you go, where can people connect with you if they want to learn more about your work, or if they want to get involved with the Northwest Aesthetics Research Group? Where can people find you?
So on Instagram, you'll find me at Dr. Olivia McCabe-Robinson, MCC, ABE Robinson. If you struggle to find that because it's a long name, I appreciate if you go on Dr. Olivia Medispa. My personal account is also linked there. But I always say to people, if you have any questions, anything you want to ask, career advice, I might not be the best person to help, or any problems with clinical cases, then inbox is always open. I'm always happy to share as much information. I think the industry is a bit too cloak and dagger, and if we can try and change that by sharing information, then that is going to be better for everybody in the long term.
Absolutely. And I'll put your Instagram, or both Instagrams, in the show notes as well. So if you do want to find Olivia, just look at the show notes, and then hopefully you should just be able to easily go through to her Instagram. But no, thank you so much, Olivia. It's been such a pleasure having you on, and yeah, thank you.
Thank you.